everyone. Hi, Sir Rafi. My name is Christine Mitalang. I'm from BSN2 of the College of Our Lady of Mount Carmel. And today I'm going to do a return demonstration on a proper way of doing the PHN bag technique, or what we call the public health nurse bag technique. Okay, so let's start. So upon arriving at the patient's home, we make sure that we put our PHN bag on a table lined with a clean paper. So we make sure that, so let's go ahead and get the clean paper. We make sure that the clean part should be out, and of course the folded part should be the one touching the table. Okay, and of course this is for us to avoid contaminating our bag. So now, let's go ahead and of course put our bag in here. And then after that, we ask the family for a basin of water or a glass of drinking water if tap water is not available. So we're gonna be using the water for hand washing. And then after that, if once you already have the water, I already have it here, we go ahead and open our bag. And then of course get the soap, and at the same time the towel, the clean towel. And then let's go ahead and proceed with hand washing. So let's wash our hands with the soap. Make sure we clean it very well. And then after that, we go ahead and of course clean our hands with the towel. And of course, after that, we go ahead and take out the apron and put it on the right side of the bag. So we'll be using this apron to protect our uniform later on as we do the nursing care treatment. And then after that, we go ahead and prepare all of the materials we'll be using for the nursing care treatment. Okay, this is to make sure that we have all the equipments accessible. Okay, accessible as we do the procedure. So right now we'll be doing wound care. So I'll be needing, of course, a gauze pad. I'll be using a medicine tray where I can put, of course, I'll be needing a bandage scissor, the povidone iodine, a cotton tip applicator, a micropore. I'll also be using cotton balls, 70% isopropyl alcohol, and of course our clean gloves, and at the same time, of course, the waste receptacle. Okay, so after that, after we have all the materials ready in front of us, we have to close our bag to avoid contamination and put it on one side or one corner of our working area. So let's put it here. Okay, and then before we go ahead and prepare all the materials, and then we can now proceed with in performing the procedure. Of course, in performing the procedure, the first thing we have to do is to put on our apron. And then at the same time, we also go ahead and of course, I'll do just a quick hand hygiene. And then of course, put on our gloves, the clean gloves. Okay, so Alright, so, and then we go ahead and, of course, proceed with the procedure, provide a procedure for the patient. And this is, of course, for us to provide comfort, for us to provide security, and hasten the recovery as well. Okay? So, let's just pretend that I'm done with the procedure and all. So, after we're done with the procedure, of course, we go ahead and, of course, remove our gloves. Okay? Put it on the waste receptacle. This one as well, we use for cleaning the wound. And then after that, we clean all of the materials that we've used before putting it back on the bag. Okay? So, I'll be needing cotton balls, a 70% isopropyl alcohol. Okay? I'll be first cleaning the bandage scissor. Micropore. This one as well. So after we have this ready, so we just get our waste receptacle, make sure to dispose it properly. After we dispose it, we go ahead and do hand washing. Okay, so we get the soap again, do hand washing. Wash our hands, and then we go ahead and dry it. And then after that, we go ahead and, of course, open our bag. Take our bag, open our bag, and put the materials, the clean materials, on their right places. Okay. And then, of course, after that, we take out or we remove our apron. We fold it away from us. We make sure that the soiled part should be folded inside and the clean part should be folded outside. Okay. And then put it inside our bag. And then same goes with the paper lining. We go ahead and make sure, by the way, in the paper lining, we go ahead and fold it and put it in our bag. And then after that, we make sure that, of course, we close our bag. So after we've done that procedure, we go ahead and take out the patient's record. We also speak to the mother. We write down all the data that we've gathered, we've observed, the nursing care and the treatment that we've done. And at the same time, we also go ahead and give instruction for patient care, especially if the nurse is not available. And then, of course, lastly, we go ahead and make an appointment for follow-up care. Okay, for follow-up care, it's either in the clinic or at home. And of course, making sure that we're very specific, or we highlight the date and time that the follow-up care will be performed. Okay, so basically that's it for the PHN bag technique, and I hope you've learned something today. Thank you so much, and I hope you all have a great day. Thank you. Bye.